Welcome to Tea Time with the Doc. I'm Denise Nunez, general pediatrician, and we have here today Pamela Jimenez. Thank you so much for coming here today with us.
Thank you for having me.
Absolutely. And Pamela, it's a little surprise for everybody, but I want them to know who are you and what you do.
So I, like Dr. Nunez said, I'm a behavioral health clinician located at Jimenez Pediatrics. I work with children from ages 0 up to 21. What the model of my work believes in is collaborative care. So basically is working along with the primary care doctor in seeking for the best treatment, the best help that we can find for patients who are struggling with any sort of behavioral problem in school or at home. It could be depression, anxiety. We see cases such as ADHD, up to severe anxiety. Also cases just simply stress management and coping skills, social skills that could be affecting behavior at school or at home.
We have patients, parents that come in worried about, it could be a tiny aspect or it could be a major aspect of their child's behavior. What should be the process the parents should follow when they have that concern and they come and visit us? Some of them would say it. Some of them, when we ask them questions, they kind of mention it, and some of them are really verbal and they will. But what would be the process that you recommend to our parents for these type of cases?
Okay, so luckily, the collaborative care model means that we work together. So this is where our work would come in place. We would, well, as the doctor, you would kind of sense if there's something that's off or if the parent feels uncomfortable speaking about something. So the warm handoff would be done at that moment, which is basically the primary care provider, as the confident, as the person that the patient is comfortable with, would introduce me as just someone in the clinic that can help with some problems that they seem to be presenting, behavior concerns. And I would come in, introduce myself, and kind of give them, lay the options of what can be done. If it's the school, I could work in collaboration with the school and the parent to come up with the best alternative solutions. If it's the patient itself, let's say if it's a teenager, that I could work one-on-one, that I would introduce myself and the alternatives that we could offer in terms of providing the best care for that patient.
Thank you. One other thing that I always ask parents, that it doesn't matter what your questions are or your what you feel that's not right with your child. It's always good to bring it up, especially when you go to your pediatrician, because a pediatrician can, as Pamela said, it's a teamwork, and we can all together figure out what to do. I know there's some screening tools that you have. So us as pediatricians, we will do our visit and we'll check some little details and see if it needs more screening. And that's when we kind of look and more adapt and say, you know what, I think we need something more, and a deeper screening on your child, and that's when we refer. So I always ask them, it doesn't matter what it is, always let us know. And that way we can actually refer them to you, and you can do a deeper screening. Would you mind just telling the parents what screenings you have available for them to understand what alternatives they have?
Sure. So I usually start with a universal screening. It's called a pediatric symptom checklist, and it basically screens emotional and social problems. So I would start looking at more or less where the problem is leaning towards, if it's emotional, if it's social, or if it's just behavior overall. Once I screen with the first one, I'll move on to whatever follow-up screening. So let's say if it's a behavior concern, I will move on to a SNAP, which is more focused on behavior, hyperactivity, common in ADHD. If it's more emotional, I will move on to either PHQ-9 or GAD, which is anxiety or depression, and slowly move on from there. After the screenings, I do a brief intake, which is basically gathering as much information as I can about the family history, any medical history, anything that can pinpoint where the problems began or maybe where they come from. Usually, parents are surprised to know how much family history can connect to what the current problem is, but I do like to point it in a way where we don't know when it started. We're dealing with the here and now, but it's really good to have an idea of when it started and start treatment from there on.
How long is this process? Like the screening, how long would it take? And then after that, how long is the process take?
So the screening takes around 45 minutes to an hour. It's a very long process just because it's a lot of conversation. So out of a simple question like, is there any family history of mental health problems, I would get a lot of information from that one question. So I would always recommend to have 45 to an hour available when coming in for an intake. After intake, follow-up sessions would be 25 to 30 minutes.
In one intake, do you do several screenings, as you said, or you just do one and then you have them come back for other screening tools, or it's just, how does that work out?
It depends. It depends on the presenting problem.
Mm-hmm.
Like I mentioned previously, if it's a problem of just behavior and it's clear and that's the main concern, then I'll do one screening. If it's a combination of problems happening in school and at home, I'll do several screenings. And if the screenings take longer than expected, then I would have to recommend a second appointment to continue screening.
Ages. How is your youngest and how old is your oldest?
Okay, so I have patients as young as 2 years old for behavioral problems and as old as 20.
Okay. And should we get a little bit into the autism or the autism spectrum, which you want to mention a little bit about it? I know it's a very delicate topic and very interesting, and it's kind of changing along the way. I've learned so much with you. Every time I think it's one thing, you come and tell me, no, this is autism with this variant. So should we give a little bit of a glance, because I think this is a kind of another topic by itself and we won't be able to cover it today, but we can give just a little hint so then we can, and then next time talk a little bit more in depth about it.
So after I screen for autism traits, autism behaviors, if the screening comes back positive, I recommend a referral for a more in-depth assessment for autism.
So this is a very, very interesting topic for every single one of us and all our patients. What we're going to do is I'm going to ask Pamela to come back, and so she can help us a little bit more understand autism and all the different variants that there are out there. I've learned so much from Pamela, and I really appreciate actually today teaching us about behavioral clinic that we have at Divino Niño, what you do, which is so, so important. And the most important thing is that I do recommend, and we recommend the parents to come, when they come to their visits, ask us all the questions they have. If they feel that there's anything that's not right in their child, there's always good to ask. I don't know if you have any recommendations, any final recommendations to our parents, or do you want to say something?
Yes, I would just reiterate what you said, the importance of just speaking whatever you see if you feel like it's uncommon. Parents have gut feelings, and
Yes.
it's always important to follow that gut feeling.
You have that gut feeling, and so we always offer some advice and some help.
And it doesn't
Right.
necessarily need to be a diagnosis,
Yes.
which I know a lot of parents fear.
Mhm.
A label, which is the word I was looking
Yes,
for.
very good.
It doesn't necessarily have to be a label. There's just certain skills that we could help
Which is
just
true.
strengthen within the child. So always talk to your primary care doctor.
And the earlier you do that, the earlier the interventions, and it will help much more. So hopefully you liked our tea time with the doc today. We're going to have more videos after these videos talking about, we're going to talk about autism as we want to talk about as developmental milestones at all our ages and the kids that come to see a pediatrician. So thank you very much, Pamela.
Thank you.
Thank you guys for joining us today, and we'll see you guys later on.